I'm Dr. Mark Sclafani at One Manhattan Dental. I'm sitting here with Dr. Rob Ramundi with One Manhattan Dental.
Thank you. So it's October. Halloween's next week, and we wanted to take an opportunity to reach out to everyone and address the most recent questions that we've received from everyone. As thank you for pouring them in. Make sure any future questions, anything on your mind, shoot an email to us. Let us know of topics, of things to talk about, things that are on your mind. We pull a lot from the questions you ask us and also the questions that come up as we're seeing our patients and seeing you all throughout the day, throughout the week. So it's a combination of that. The things we're talking about the most, things we're being asked the most, and there's trends.
It seems like what we've been asked the most and repeat questions are how to better take care of your teeth. It's a great time of the year with Halloween approaching. A lot of sticky food, a lot of candy. Good time to talk about taking care of our teeth.
So we'll start with our first question: is what is the ideal oral hygiene routine that I should do on a daily basis to make sure I'm preventing disease between our teeth? Cavities, gum disease, the things that we deal with the most, right? So what do you tell patients?
So we start with the rinse, different types of mouth rinses, which we can get into later, followed by a floss, and then followed by toothbrushing, whether it be a manual or an electric toothbrush.
I do like the way you recommend people a certain way that you do. And so Dr. Sclafani does a rinse, a light brush, a floss, then a proper brush. You're doing extra.
Might be a little overkill.
Right?
I like to loosen up the food first, and that's what the floss does before you brush. So the toothbrush is also doing that, but the floss is doing that in between the teeth.
Right, and then the reason we're mostly flossing before we brush is that the medicinal qualities of toothpaste, whether it's fluoride or a different modality, can get between your teeth to help to deal with the remineralization of your teeth and help to rebuild your teeth. If you're brushing before you floss, the fluoride or hydroxyapatite, or if there's xylitol in your toothpaste, other things cannot get into this box. You're breaking up the bacteria, you're breaking up the food, allowing everything in your toothpaste to get between it, right? So toothpaste is, aside from the medicinal quality, there's abrasiveness.
Correct. And we get into different types of toothpaste also. If you want to jump to that,
I guess so. Let's talk about that for a minute, because it's a good thing to remind people about the different types of toothpaste and what we think about when we're selecting toothpaste for ourselves or for our patients. So it's a very simple principle, right?
Relative dental abrasiveness. RDA factor. How abrasive the toothpaste is. Think of it as a pumice or a sand particle cleaning your teeth as opposed to a light creamy paste. The abrasiveness is going to wear away some of the tooth structure. So we don't recommend those products with the harder dental abrasiveness.
Right. You can find this out by Googling your toothpaste or simply getting something that is sensitive. Right. Colgate sensitive, Sensodyne products. Almost any product that says sensitive has a smaller particle size. Right. Think of sandpaper. Right. There's actual silica particles that are abrasive in the toothpaste, so you can avoid using something more abrasive by avoiding whitening toothpaste. Right, so
charcoal toothpaste. And you can, like I said, Google the abrasiveness of your toothpaste. There's a lot of resources online around this, and you want to be as low in the scale. The scales show you over 100, under 100, over 100 is bad, and as you're closer to zero, that's good. So which is water,
right?
Basically.
Yeah,
I feel you can't be too low. It's more about technique and consistency. If you're using the proper technique and you're consistent and you're brushing 2 to 3 times a day, you really could be brushing with just water, and you're doing a good job. Now, I say water, I'm being facetious, but a light pro-enamel Sensodyne type of toothpaste that has no abrasive factor. This is all you need. And size matters. You don't want to be using a lot of toothpaste.
Quantity of toothpaste matters also. The more toothpaste you use, the more abrasive particles there are.
Correct.
Right. It's always funny, you think of toothpaste commercials and they show like a full ribbon.
Right.
Because it starts slow and it curls up. And of course they want you to use that because you go through more toothpaste that way.
Sure.
We ourselves, and we recommend a pea-sized amount of toothpaste because the toothpaste, like we're talking about, isn't doing a lot of the heavy lifting. You are with your toothbrush, and to make sure that the additives in toothpaste are getting through your teeth, I like to rinse with my toothpaste after brushing. So I'll brush, I'm flossing, brushing, and then I'm using my saliva and toothpaste mixture as a rinse, and I'm rinsing that throughout my mouth to try to make sure that the additives in the toothpaste that I'm trying to help rebuild my teeth are getting around my teeth and giving it an opportunity to expose itself to all the tooth surface.
And that's why it's good to finish with the tooth brushing, so the toothpaste is still remaining on the teeth.
Mouth rinse. I mean, mouth rinses are pretty simple the way I view them, right? There are recreational ones, what they call it recreational defined, or therapeutic ones. So recreational are ones that simply are for quote unquote bad breath. They have flavor and that's it. Scope is the most common recreational mouth rinse. But you want to be aware of those because almost all of them contain alcohol, right? Marvis, I think it is Marvis, and Scope have alcohol. So it's a mouth rinse that I don't think has a purpose at your house to use routinely. I don't think it's, you see them in bathrooms a lot, fine. After a meal at a restaurant or something, you want to use it, but I wouldn't say to use it regularly because the alcohol dehydrates the tissues of your mouth.
Correct. So you stick to a non-alcohol mouth rinse, and that's the first thing you should be doing in your sequence of cleaning.
And then there's a couple different kinds of mouth rinses that either target the bacteria that cause gum disease, and then there are some that have fluoride in it. So the most of the over-the-counter fluoride rinses have the same fluoride percentage as toothpaste. So it's like a belt and suspenders. I'm not sure you're doing harm. I'm not sure you're doing good by using a fluoride mouth rinse and then a toothpaste. We're using it the proper way. I don't know if there's an actual therapeutical benefit to using both of them. There aren't good studies around that. But I might err on the side of using a rinse that targets the bacteria that cause gum disease, something like Colgate Total, Crest Pro Health, Listerine Zero. They're targeting the bacteria that cause gum disease, where your toothpaste is more targeting the bacteria that cause cavities. I like that approach better. A lot of patients use ACT, right? A lot of patients use ACT, and I'm not sure that, I don't not support it, but I definitely do not openly just support it if you're brushing with a fluoride toothpaste.
If you're brushing and flossing, there's less of a need for it, would you say?
Yeah, I agree with that, right? I never buy ACT. I never use ACT. I don't understand the purpose of it.
I think of it more for children using it, maybe.
Yeah. It's just more extra topical fluoride, right?
And then there's prescription-based rinses, right? Like a chlorhexidine, a Paradex rinse, which would be prescribed by your periodontalist.
Situationally,
if needed to treat periodontal disease.
Yeah, these are more situational rinses, and so, although we have patients that use them routinely, but you want to do that under the care of one of us or a gum specialist because, again, they can affect the bacterial population of your gum and think about your gut health and your mouth health in terms of bacterial colonization. So it's a relationship that you want to be careful around. And we're not going to talk about probiotics here, but we'll maybe in a future date. I think we can go a little deeper on this topic to benefit people because we've talked about what you use, but I think technique is just as profound as a topic as what you're using. So the technique of how you're using everything. So I guess patients hardly ever floss properly. Mm-hmm. Most people don't floss properly. So I think for me, the first thing that, like the soapbox thing that I get onto is using the proper type of floss. When someone says to me that they have a hard time flossing, I think about, are they using the proper floss for them? So there's
for their situation.
For their mouth. And so there are different thicknesses in floss, thick, medium, and thin. Personally, I greatly prefer a thin floss, which would be Glide, or there's like a Johnson & Johnson Total Care, which I love. For patients with greater spaces, we love Coco Floss. Yeah. Those are the brands that we gravitate towards. So play around with the different types of flosses to make sure you're using one that can go easily through your teeth.
Yeah. So depending if you have implants or bridges in your mouth or tight contacts, certain flosses will get through.
How do you describe to floss to a patient?
So I usually will show a patient chairside how to do it in a mirror. But if I'm doing it, say, on a phone, I would tell them to grab the floss in both hands, twirl it between two fingers, pointing it with your thumbs, go in between the contact. Now, you're not going straight down and damaging the gum tissue in between. You're hugging it around the tooth. So you're kind of bending it in a C shape, and you'll get the tooth behind and then the tooth in front. So if you look at the tooth, there's 5 sides of the tooth. There's the biting surface, the cheek side, the tongue side, and then the 2 sides front and back in between. The brushing is taking care of the top, the cheek side, and the tongue side, where the floss is taking care of the 2 sides of the surface of the tooth in between. So you're hugging the surface of the tooth, you're not pushing it against the gum tissue. So if it's done properly, there shall be no bleeding during the process. You might bleed in the beginning if you haven't done this for a while, just stimulating the tissue, but eventually you should end up with no bleeding on consistency with flossing. And
I guess there's a difference between a tooth and an implant because there's no ligament around an implant where there's a tooth, so the attachment of the soft tissue is higher on a tooth.
Correct.
And lower on an implant. So we have to go deeper on the implant, right? It's like a passive with a little bit of pressure, but not too much where you're hurting yourself.
Yeah,
right? More towards the down and center, down and center
of the tooth. It seems like you're going further under the gum, but you're still running it along the tooth surface. And that's a situation where you'd be using the thicker floss to run it along an implant crown. I compare it to, I'll show a patient a mirror with a handle. A mirror has a skinny handle, and it goes up very... there you go.
Right.
So if you're flossing this, look how far deep you have to go down to the implant, where a natural tooth has two roots, and you're not going...
a lot wider.
Yeah, and you're just running it along here. So with the implant, you're going further under the gum. Not really under the gum,
it's just right
along
there.
the gum. Yeah,
it's like right there in the it's great. Yeah, and you could probably find some decent videos on how to floss properly if you just YouTube it, Google search it. Yes. It's worth doing.
They're also on our website. Anyone who's listening to my website, you can Google.
It's worth doing because it's probably the single most profound thing you can do to actually take care of your teeth and prevent diseases. Flossing properly, routinely. There's not a single thing you can do, right? So we tell patients that if you had to pick one, flossing or brushing, you would only floss. Most dental disease starts and progresses between your teeth. Mm-hmm. And so if you're not breaking up the bacteria and giving your saliva an opportunity, or the medicinal things in the therapeutics you're using, like toothpaste and mouth rinse, to get in between your teeth, you're not preventing disease and you're not arresting disease. You're not preventing the progression of disease. So it's the single most important thing you could do to take care of yourself and your dental health is to floss properly, routinely. At night, preferably, because you're cleaning out the food and the bacteria throughout the day. Right? And I guess we should take a second and talk about brushing technique.
Which has changed a little bit because most of our patients are using an electric toothbrush.
I think so.
And then the brush is doing more of the work for you.
Which we prefer.
Which is great.
We prefer electric toothbrushes. Sonicare or Oral-B are the two that we advocate for ourselves and our patients. And then how do you brush with an electric toothbrush versus a manual toothbrush?
Yeah, so electric brush is pretty much doing the work. You're still touching the same surfaces of the teeth as you would with a manual toothbrush, but you're just holding the brush there and let the oscillation of the bristles do the work. Or in a manual toothbrush, you're manually maneuvering your hand. It was called the modified Bass technique, where you would hold the manual toothbrush at a 45-degree angle on the outside and inside surfaces of the teeth and scrub away from the gums. Here with the electric toothbrush, you're not scrubbing away from the gums. You're resting it between the tooth and the gum tissue, and the movement of the toothbrush is cleaning the surface of the tooth.
Right. Both are equally effective if used properly, but I think it's easier to use an electric toothbrush properly because you're not doing the work, right? And there's a timer built in. Yeah. So invariably, you're just moving it slowly around your teeth instead of really going to every tooth surface. You have to be so much more present and aware, not thinking about what you're doing next, not thinking about anything from your day. You have to really focus on getting all the tooth surfaces and spending more time. As they've done studies on brushing, the effectiveness is about the duration, not the intensity. So if you scrub real hard, it's not going to be as effective cleaning it than if you're spending your time and slowly moving over the same space. Yeah. So it's the amount of time, and that's why electric toothbrushes are our go-to, because the time is built in, and it's less likely that you'll get lazy or feel like you're doing it forever or rushed because the timer is helping you get there if you follow it. I don't always follow it, but
it's hard to go the full 2 minutes, but the duration is 2 minutes. A minute for the top, 30 seconds on the outside, 30 seconds on the inside, and the same for the lower arch. And obviously, we're doing the biting surfaces of the teeth also.
They say to sing a song as you do it. I don't understand how you can do that. They say sing happy birthday. But how do you sing and brush your teeth?
You'd be drooling too.
I would be everywhere. It'd be a mess.
That's why you want to use less toothpaste, I guess.
Yeah, less toothpaste and not sing. I don't know. So the next question that we have, or another common question that we get is, how do I know I have a cavity, or we diagnose cavity in a patient and they're unaware of it. They say, I didn't feel it. So I guess the first question is, we don't know this number exactly, but what percentage of cavities do you think are felt? Which percentage do you think patients do not feel, if you had to pick a number?
Well, I don't know if it's about percentages. It depends on the consistency going to the dentist, right?
Mm-hmm. Okay.
I would think.
So if people are walking,
small
10
cavity
people,
that's just starting between the teeth, you're so unlikely to feel it, right? Very, very rarely.
So like a 1 to 2% chance you feel it.
So unfortunately, when you feel it, it's something.
It's too large.
It's not too late, but it's either something's cracked within the tooth, or the decay is advanced that it's closer to the nerve that you feel in the temperature sensitivity. We talk about temperature sensitivity is one of the signs you're going to feel. You're going to feel pain upon biting, maybe some bleeding gums. All these things are probably because you've neglected going to the dentist.
Or even not, right? So how many times do you see a patient in hygiene and you find the decay and they're unaware of it?
Most of the time.
Most of the time. I would say it's over 90% of the time.
On the other hand, I've had patients who've never had a cavity in their mouth and they've got pain upon biting and they've cracked the tooth.
Right. That's a separate thing. So just to wrap that up, I think around cavities, I think most people do not feel decay when it started, when it's progressing. Most people, the majority, over 90% of patients who have a cavity are unaware of it. Correct. That's our observational number.
Right. It might have been tweaked a little bit more in the last couple of years with COVID, and people haven't been here in 2-3 years, and they've come in.
I don't know.
Larger cavities, but
and then so if you are feeling decay, most likely it's larger, not smaller.
So cavity and pain kind of could be two different things, right? The pain could be biting.
Correct. So the best way is to stay on top of your dental appointments and to take your regular radiographs, right? Take regular radiographs. That's one of the only ways we can see decay between your teeth. We cannot diagnose decay without taking radiographs comprehensively in someone's mouth, right? It's an incomplete exam. We may be missing things. Commonly patients say, don't find anything. I always like to think, well, don't miss anything. Because missing something today means that it becomes bigger tomorrow.
Correct.
And so it becomes a bigger problem as time goes on. So most ways, you do not know you have a cavity. Now, we can talk about the other major disease that our patients deal with is gum disease. Do you think that most people are aware they have gum disease?
No.
Right. So this is the problem with our profession or the diseases that affect patients is the patients that are really good about coming in, that are on top of their care and coming routinely, we find things when they're smaller and deal with them before they start. Where if you happen to be neglectful or not on top of your appointments, your dental disease will progress, will be greater because you're unaware of it. Heart disease and cancer are things that people do not feel. Dental disease fits in the same category. It's something that in most stages you're unaware of. But I guess there are some signs and symptoms, like you mentioned, about gum disease. And the simple thing is, like you said, when you're flossing, your gums may bleed.
Gums are bleeding.
Right? It's showing a sign of inflammation in your gums. The gum tissue becomes inflamed. The capillaries become permeable. And as you stimulate that, the blood pushes out of it. So a sign of bleeding when you brush or floss throughout your mouth is a good sign of gum disease. And that's maybe one of the only signs you can tell someone to observationally pay attention to at home.
Probably the only sign that you can see at home. And,
Can't think of anything else.
And even that you don't see all the time.
Right? You don't feel pain.
Plenty of our patients that they come in and you can see their gums are all inflamed and they don't complain about bleeding gums. Probably because they're not flossing enough and they're not brushing enough.
I guess we could talk about there is some sensitivity as the cavity gets bigger, and that mostly would be sensitivity to cold alone.
Yes.
Right?
Yes.
Right?
Yeah.
And as the cavity progresses, you may feel a different
hot sensitivity.
Right. And so we use hot sensitivity as a diagnostic test for diagnosing the degree of a cavity. And right. So if you have lingering sensitivity to heat, that's a classic sign of you needing a root canal, right? The tooth would be exposed to heat. You could do a hot tea or hot coffee at home and swish on that tooth. You swallow the tea or coffee, and then the pain persists for over 10 seconds. It lingers on in a throbbing manner. That's a good sign that you have a large cavity that the tooth would require a root canal.
Where cold sensitivity could be a number of different diagnoses. It actually could be a healthy tooth should test cold with a long stimulus of cold after a duration of time.
Yeah.
A broken filling, a small cavity may elicit cold sensitivity also. A cracked tooth may elicit cold sensitivity. A lot of these are treatable. The hot sensitivity is usually only treated by a root canal.
Good.
Let's circle back one more thing to home care, which we left out, was a tongue scraper. Another thing to be concerned about is a bacteria sitting on your tongue. I think the mouth rinses are great for that, but if you can pick yourself up a tongue scraper and work that from the back of the tongue forward, you'll eliminate a lot of bacteria on the tongue that causes bad breath.
How do you use it?
Well, it's almost like a tuning fork. It's got two handles.
Yeah,
and you'll hold it.
Like tuning fork.
It's U-shaped, and you'll hold it on the back of your tongue and pull forward. And you can do it several times until you feel your tongue feels clean. And you'll actually see the bacteria coming off. It'll stimulate the saliva flow as you're doing that. Careful not to gag yourself.
And you could put a little toothpaste, a small on it itself, a small amount, and then pull it up. It's abrasive, right?
Yeah.
And the fluoride can help to kill the bacteria. So fluoride doesn't just help to rebuild your teeth; it actually can kill bacteria through its chemical properties. So, seems like we're always talking about tooth whitening. It's a near daily conversation we're having with patients. So, I guess we could spend a minute in talking about that and. Talked about it 1,000 times. So why don't you go through the ways of you can go through it?
I always look at people's expectations when it comes to tooth whitening. People come in and they say, "I don't want my teeth too white." So people think they're going to get too white. Maybe they're looking at porcelain veneers or porcelain crowns. Sometimes that look too white, and they think the teeth are going to get that white. So there's 2 or 3 ways you can whiten your teeth. In the office, where you can sit down for a chair whitening procedure, and we can get into the details of that. The second would be custom trays from a dentist that you'll take home and bleach at home.
Right. Those are the 2 prescription strength methods. At home with custom trays with prescription gel.
Correct. And usually
or in the office.
And we'll do them in conjunction sometimes. The patients having an in-office bleaching, we'll follow them up with custom trays to maintain that.
Right. That's our preference for someone who's whitening their teeth and want a sustainable way to either get whiter up front or to maintain the whiteness is to an in-office procedure, which lasts between an hour and an hour and a half, followed up with custom trays and prescription gel used at home for 3 to 5 times, which would be once a day for 3 to 5 days, or not at all, and used in the future as rebound occurs. And the common question around this procedure is, how long does it last? So the literature shows that an in-office procedure by itself, that whiteness maintains for 18 to 24 months by itself. If you use the at-home trays, you're getting beyond 24 months. So if you're happy with your whiteness, your degree of whitening at the time of the appointment, you don't have to whiten, but you have the solution to maintain it in a year or 2 as things rebound. Or you can whiten right after the procedure to get yourself a little whiter, and then you'll kind of dose it as you feel needed. Some of our patients turn to, which I would call the simplest, cheapest measure, which is an over-the-counter solution. We like to recommend the Crest White Strips because they're the most tested solution out there. They've been around the longest. They seem to work better than a lot of the other gels. I want to make sure that I stress that of all the at-home, over-the-counter methods, they're pretty much the same. There's not one that's better. There's not one that's more effective. There are a lot of gimmicky ones that have these little lights, different activators, some you can brush on your teeth. From our perspective at this point of this recording,
there's no studies that show any of those work.
There are no studies that show any are better. No. They're all the same chemical makeup, and they all work the same way from a chemistry standpoint. So they're not truly being enhanced by any of the bells and whistles. If you want to use it, I don't think you're harming yourself. I just don't think you're helping yourself. So it's cheaper and faster, but there's a downside with the at home. The 2 downsides are it's not as effective.
Yeah, it doesn't have the chemical just doesn't last on the teeth as long. It's an hour duration.
And you had a patient who texted you a photo a couple days ago who they annihilated their gum tissue.
Gum tissue turned white.
Right. They chemically burnt their gum tissue from the at-home over-the-counter solution.
So the in-office procedures, whether it's a take-home tray or the hour in the chair, we can control that better. We can put a material on the tissue to protect the tissue. The trays are carefully scalloped to follow the teeth, so when you take it at home, you're not having the bleach pour out onto the gum tissue.
Right.
And we like to do this procedure on a lot of our patients that are having some crowns or veneers done on, say, just a few teeth, and they want to whiten everything everything around that. So we can control the color better when the patient's whitening with the trays or in the office before we select the color for restorations that we're making following the bleaching.
A lot of patients ask me, does it harm my teeth? I've heard that it does. I think this was something when whitening first came out in the 80s and 90s, that people believed that it impacted the crystalline structure of the tooth itself. And the literature shows that if it's dosed properly, the way we're suggesting, there's no harm to your teeth chemically and no harm to the strength.
No long-term, maybe some short-term sensitivity.
Good. Yeah, that's the one downside of all whitening methods, is that it temporarily dehydrates the tooth.
Dehydrates the teeth.
Resulting in some nerve influence of the pressure change, and then that tells your brain that there's sensitivity. It's an interesting physiological pattern of the simplicity of the nerve within our teeth. It's not a very complicated nerve, so that pressure change tells pain when there's subsequent pressure change from the influence of temperature.
And there's different types of desensitizers that the patient can take home and use in conjunction with the whitening. Potassium nitrate is one of them. They can also be applied inside the tray, and they can wear that for a few minutes after bleaching, which will minimize the sensitivity to cold.
Yeah, we like to have our patients use a sensitive toothpaste for the week or two prior to whitening. So you can do this yourself if you're using it at home over the counter, or even the at-home prescription, is to use the whitening toothpaste for the week or two prior to whitening your teeth, because that'll help to minimize sensitivity.
And then NSAID, anti-inflammatory, will help prior to bleaching.
Yeah, at the moment of,
Right before.
Something we find ourselves talking about with patients more than ever is their diet and how it impacts their overall dental health. And it's on people's radar more. I think COVID did some good things about people looking at what they do and their habits and how it can contribute to their health holistically, systemically, and also dentally. We're having a lot more talks with patients about their general health and things that impact it along with this. So what do you find is something, I think a blind spot, I'll call it, that patients have around what they're eating and how it affects their dental health negatively?
A lot of snacking at night, a lot of drinking of sugary drinks. I have a patient who's telling me he's wakes up in the middle of the night and has a handful of pretzels. And then he goes back to bed. And my sugar intake is low and I need more sugar. And,
should wear a CGM? No. Right, so snacking is an issue because it's about quantity of exposure of carbohydrates. So pretzels are a great example in terms of introducing carbohydrates to your mouth that feed the bacteria that cause tooth decay. So eating between meals is one of the biggest things that can impact your dental health negatively, opposed to having 3 or 4 meals throughout the day without snacking. Mm-hmm. So people snack on all sorts of stuff, dried fruit, pretzels, sweet things, carbohydrates, fruits. And like you said, snacking can really dramatically help hurt your dental health because of the nature of the exposure, the time of the exposure, and the quantity. So if you were to have 2 different snacks, you could have a pretzel during the day, or you can have a piece of dried fruit. We would probably say for your dental health, the pretzel is better.
So what would you say is better? To have them in a row or spread them out through the course of the day?
Yeah, I would not.
Right? I don't
think spreading them out throughout the day is a positive thing. Sticky is worse than non-sticky. So if you could eat a dried fruit or a piece of chocolate, the sticky sugar, whether it's like a jelly bean or dried fruit, has a greater negative impact on your dental health than a piece of chocolate or a pretzel. So the nature of the carbohydrate matters so much because the bacteria can ingest those carbohydrates, and the longer they stay within the plaque, the more bacteria can proliferate and the more acid they make that affects your gum tissue and your tooth. And so they can digest and store these carbohydrates, the sticky ones, for hours, where it's harder for them to store the less sticky or the non-sticky things like chocolate and pretzels. Yeah. Also, with snacking throughout the day or grazing, you're probably going to have a higher calorie intake throughout the day. So systemically, you might be ingesting more calories than you need. This is why time-restricted eating or intermittent fasting has become so popular, because there's a lot of studies that show it's healthier. But in actuality, it's probably tied to your caloric intake not as much as it's an eating window being smaller. So if you eat the same amount of calories over more time versus the same amount of calories over less time, systemically, there's probably not much of an impact in health because you're not really fasting. Fasting doesn't happen until 3 days. But anyway, into the stickiness in carbohydrates. That's one thing that we want patients to think about, and then what they do after they ingest. So if you're a patient who wakes up and has some pretzels, what would you right? The first thing, you drink some water.
Exactly.
And then clean your teeth again.
It just makes sense. Those type of
clean your teeth again.
Just staying. You could feel them staying on your teeth more than you could feel a piece of chocolate. So if you are snacking at night,
you should
rinsing.
You should rebrush,
brush again,
refloss, rebrush, reclean your teeth. Yep. Right? I mean, we could talk about the impact it has on your sleep. We cannot advocate eating at night. There's so many problems around that. I wonder why people do that.
Go back into sleeping.
Yeah, that's a different topic altogether. Yeah. And then what about patients that are sipping on beverages throughout the day?
Same thing. Are you drinking water? Or are you sipping on Coca-Cola or Gatorade throughout the day?
Are you sipping on seltzer?
Which is even worse, right?
Right. It's another blind spot.
If you drink seltzer, it probably should be drank with a meal, not just on its own to hydrate.
No. You can look up the pH of the beverages that you intake. So 7 is neutral, above 7 is basic, below 7 is acidic. As you get further down the scale, the more acidic it gets, closer to 0. As you get higher to 14, the more basic it gets. Like alkaline water has become very popular. It doesn't do anything for your actual body, right? Ingesting alkaline water does not alkaline your body. It doesn't help to make you less acidic, right. But it does help to make your mouth less acidic. So I do like alkaline water after eating, just to even rinse with it because you're rising the pH of your mouth. The problem with when you have acidic mouth is it breaks things down and it feeds the acid. It feeds the bacteria that can attack your teeth. They live in an acidic environment and they produce acid as a byproduct of their carbohydrate digestion. So what are a few things that have pH that maybe people don't realize? Like you said, seltzer, carbonated beverages.
Carbonated beverages are the worst.
Coffee. Coffee is a pretty bad one, right? Coffee is very acidic, whereas a lot of teas aren't as acidic. You mentioned
so it's a double-edged
sodas
sword with the sugary drinks, right? It's like a lemonade is a high sugar intake, and it's a high, and it's a very acidic.
Yeah.
Low pH.
And that also can spike your blood glucose, and sugary beverages are probably one of the worst things you can ingest for your mouth and your systemic health. There's not many beverages there, so you gotta be careful when you're doing smoothies or, I saw this great guy on TikTok breaking down the caloric intake and sugar intake of like the pumpkin spice lattes and the beverages from Dunkin' Donuts and Starbucks, and even the local coffee shops that make a latte, and the things they're putting into it, and then quantifying the amount of sugar in it. There's so much sugar. There's so much. Some of these drinks can have 1,000 calories.
Yeah, more than the meal. More than
1,000, 1,200 calories in a single beverage. Yeah. It's incredible. It's incredible, right?
So if you're having those sports drinks, which we all do once in a while, especially if you're working out, you want to finish with water. It's just to rinse it off your teeth.
I think we can advocate an electrolyte beverage without carbohydrates. So we like to use some tablets. They're the one that I use every day in the morning when I wake up. I have a Noon. Now that's probably acidic. I'm not even sure of the acidity of it. A little tablet you put in to 16 to 20 ounces of water and you drink it. At one time, it's not a beverage I'm sipping throughout the day. I start with that. So I also do that when I'm working out more. It helps to replenish the sodium, magnesium, potassium in your blood to help to rehydrate better than water alone. So I like doing that, but I know it's acidic, so I drink it at a single sitting within 10 minutes. Yeah. Within 5 or 10 minutes, I'm drinking that. And the reason I'm not chugging it out right is I probably have a little bit better absorption if I sip it. I'm not sure. I'm not sure either. I'm not sure.
It's the same with the vitamins, right? In the morning when you drink
it. I'm not sure. It depends on the vitamin, right? It depends on some states take on empty stomach, some states take with food. It just depends on the absorption of the vitamin itself. It's fat soluble or not and whatnot. So we get a lot of phone calls from patients or text messages or emails of they've had an emergency and they don't know what to do, right? It could be something came loose, something broke, or they have a toothache. So I guess we can go through a few of the different common emergencies and what you can do to help diagnose what it is. and what you can do after you do that. So I guess the most common thing and one of the worst things is when someone has a toothache. So I guess what questions would you ask a patient? Said, oh, hey doc, I have a toothache. What should I do? I'm away right now. I'll be back in New York in a few weeks or whenever. What should I do right now to help diagnose what it is?
So those are the best type of emergencies. I prefer those over the broken tooth in the front of the mouth.
Well, it's a simpler solution. It's a simpler solution, typically. And so what do you ask the patient to look for?
First, you're going to start off with what we said with the signs of tooth pain. Is there any temperature change?
Okay, so influence in temperature, right?
What kind of pain are you having? Is it temperature pain?
Cold or hot? And what are the things to look out for? So what's to look out for hot?
Hot sensitivity is going to linger. You drink a hot cup of coffee, it may linger for 10 seconds afterwards. Whereas a cold could be immediate response to cold and can dissipate.
Immediately dissipate. That's not as troubling.
Correct.
That might mean you have decay or just root surface sensitivity.
Right. Well, the cold could go a little bit more consistent, a little longer also.
Yeah.
Right? More of a sign of a bigger hole or a bigger cavity, perhaps.
But typically with someone needing a root canal, we would look for lingering heat sensitivity. So the first thing you can do is test temperature. Test them cold, test them hot, and see what happens to your tooth. If it's lingering heat, you probably need a root canal. If there's no influence with heat and there's no influence with cold, but it's still a toothache, we'll have you test something else. And that's when we would have you bite into the tooth with something. I like to tell my patients something like a pen could work well. Right? You can take
something a little give that's not going to fracture the tooth.
Right. You're not going to push that hard. What you would do is you would use either the teeth on the other side. Let's say I was having pain on my right side. I would test my left side or test an area away from the tooth and work towards the tooth. And you want to test baseline first, work towards the tooth. So if it hurts as you depress on the tooth and you're having a toothache, that's another sign that you may need a root canal. So either heat or pain on depression, pain on pressure, is a sign that you can need a root canal.
Another common pain I see a lot of is throbbing from the gum, which could be related to just something caught between the teeth.
Right.
Or broken filling between the teeth that dislodge and there's something stuck between the teeth. Those are things you try to get out where you floss, and sometimes you push them further under the gum, and the gum reacts by bleeding. Could be also cold sensitivity related to that. That's something that you're going to have to see your dentist to treat. Well, probably all of these are.
Right, so that's a good thing to try to differentiate from. Is it tooth pain from temperature or depression, or releasing it, right? Or is it your gum pain? Because a lot of times the patient will just have something caught in your gum tissue, between your teeth, that needs to be removed by gently, properly flossing or by your help from your dentist, and that can relieve the pain. So the gum pain or tooth pain. And the other thing we can talk about is if you're having what you think is a toothache and you're pressing the tooth with something firm.
Yeah, I'll go even a bite stick, an ice cream stick.
And you let go. Ice cream stick.
Ice cream stick.
Yeah, good. Or let go of it. That's a different sign.
Pain on release.
Pain on release is typically a fractured tooth.
Yeah.
Right? And we're talking about a fracture along the root, not a fracture you may think about where the cusp breaks off where you can visibly see the fracture. That's a fracture within the actual integrity of the tooth, down the foundation of the tooth that you cannot see, that is causing pain, that the ligament and the gum tissue around the tooth is responding to. So pain on depression, root canal, pain on release, fracture, pain along the gum tissue, probably some type of foreign object getting caught within it. And then there are, of course, what do I do when I just fracture a piece of my tooth? I bite into something and it breaks. Well, obviously, anteriorly, you need to get it fixed for aesthetic reasons. But if plenty of patients break a tooth and there's no symptoms, so I tell those patients not to bite on those teeth or anything hard, but to still keep it clean.
Yeah. So if there's a small fracture within a filling or within a cusp of a tooth, that little piece could break off and associate with no pain afterwards. Actually, could be less pain. That little piece could be moving, and when it breaks off, the cause of the pain is gone. Still will have to be repaired in your dental office. But a lot of times, chipped teeth do not elicit any discomfort or any pain.
Yeah, I think people get worried about, is the pain going to get worse? Like, it doesn't hurt yet, or it hurts a little bit. I'm very much worried between now and the time I get in. What can I do to make the pain worse? I'm not so sure you can do anything depending on the emergency of the term of a structural break. A toothache, like we spoke about earlier, can get worse on its own. So that's something that should be addressed pretty quickly. Where these structural issues that occur posteriorly, as long as you keep them clean and avoid biting on like a cough drop or something really hard, you're not necessarily going to make it worse. If plenty of patients have been on vacation, something breaks, and there's no discomfort, so enjoy your vacation, right? Take a picture with your phone or have someone take a picture. We look at the picture and say, okay, you're fine for now. Keep it clean. Don't bite anything hard. Enjoy your vacation. I'll see you when you get back.
Another dental emergency could be a crown came out. A patient lost a dental crown. They still have the crown, and that could be sensitive or it could be no tooth pain, depending on what's underneath there. In this case, we'll tell the patient to hold on to the crown until they can come to our office or another dental office to have it re-cemented or at least reevaluated to see if it can be re-cemented.
There are things that are sold at pharmacies. I do not think any of them are worth it.
Re-cement a
There's
crown.
a company called Dentec who makes some paste and things. They're too thick, right? They're really thick products. And so if you have a crown come loose and there's not a lot of thickness and you try to put it back in, it's not really going to hold it.
Or the worst is the crown's now not seated all the way.
Right.
And now that's the first thing that touches when the patient
can't bite into it.
And that's going to cause more discomfort. The only time I'll tell a patient is if a front crown comes out and they're on vacation and what to do without a front crown. And for me, the simplest fix, because it's a thinner, is a denture adhesive, a Fixodent.
A very small amount.
And that'll hold you temporarily till you get to a dental office. And again, I don't really love recommending that because if it comes loose, you could swallow it.
Swallowing or aspirating it is the worry there.
But if it's an aesthetic issue, it's the only time I would recommend that.
You can wear it during the day and take it out at night too. Right? I mean, what else are you going to do?
Doc, I just put it in. Now you want me to take it out?
I know. Well, I hate to lose it or aspirate it, right? And I guess the only other part about a tooth needing root canal, I don't think we said, is that it's the pain that wakes you up at night. Typically, you're okay-ish during the day, but while you're sleeping, the pain will increase and cause you to wake up during the night with this throbbing and such. So that's another sign that you need a root canal. So from our perspective, when someone calls with an emergency, we're trying to assess what it is. We're trying to assess what the emergency is by going through these steps and asking you questions to make sure we funnel you to the right person, if it's ourselves or one of the specialists that we work with, to make sure you get the right kind of treatment. We're trying to figure it out. All right, well, that's all for today. We tried to get through most of the topics. We have a few more things to talk about in our next talk with you in November. We'll cover sleep for sure. We just didn't get to it today. If you have any questions around sleep, make sure you let us know. And anything else, please. We do these. We block out about an hour a month, sit down and talk with you about questions because we're trying to make sure that we're giving the information that's really helpful, actionable information that you can use to be healthier, take better care of yourself, be informed. We view our relationship with our patients more than just the moment we're seeing you, but throughout your lives and throughout our lives together. So we appreciate it. We appreciate the trust. And let us know what other things that we can answer to help you.
I agree. All the above. Anything that we could do better to help you, help this experience. Stay safe. Happy Halloween, everyone.
Happy Halloween.
Remember, avoid those sticky foods. Stay hydrated.
All right.
We'll see you next month.
Bye-bye.